So a very interesting post I came by when you had posted, how comfortable are people knowing that their therapist could be a bot or they are going to a bot for therapy. What inspired what inspired that
What
post?
inspired that post? That post was actually for a talk on is AI going to replace the therapist sort of.
Yeah.
So I said, let me ask mental health professionals what they think. That's one part of it, but also people who have experienced therapy and some of whom possibly may have tried therapy with a bot as well.
So, but what is your opinion about people going to Google and internet platforms looking for therapy? They just Google therapy online and they actually start taking therapy there. What is your opinion about that?
No, so okay, that is one part. When we were having this discussion, there's this other interesting aspect where you can people have tried, and there's quite a large group of people who have tried seeking therapy from Chat GPT. Uh,
Yeah, I want
so,
to get to
so
that. Yeah.
that kind of situation is one thing we'll talk about. Of course, going to Google for information is good. Looking for a therapist online is the thing to do, right? Meaning, or yeah, there are a lot of people who would take recommendations from other people, but a lot of people who don't know where to seek help. I think that is one place to start. And
Right.
we know with a lot of people that they have been to multiple therapists before finding the right fit.
Right.
Uh, and that's fairly common, and it's not I think it's important for people to know
Mm.
that it's okay if you speak to two therapists and feel that okay, this doesn't quite work for me, or this is not the right modality of therapy for me. This therapist doesn't seem like the right fit. Is all fine. So I think absolutely nothing wrong with looking for help online. Uh, Information online, although there may be a mixture of all kinds of information, but still there is also a lot which does help
Yeah.
people get to the right place.
Um, Coming to the second aspect of it, Chat GPT, you said, right? So, I mean,
No.
let's just quickly get to that.
Hmm.
I myself actually typed on Chat GPT just out of curiosity, asking it
Hmm.
to pretend to be a therapist with a lot of experience and,
Hmm.
ask
Hmm.
me
Hmm.
questions. And this curiosity came out of a post that I had seen a couple of months ago, which actually gave a prompt for ChatGPT to act as
Correct.
a therapist and ask follow-up questions.
Okay.
Um, and like not end on a closed note, keep asking open questions so that the conversation goes on. But in my personal experience, ChatGPT just asked me a couple of questions and didn't really pick out anything as a normal human would, even in a conversation. Um, so, what are your opinions about
So there are
ChatGPT and stuff like
actually a
that?
lot of prompts as well available actually
Yeah,
about looking at uh, various options, and the better prompts that you give ChatGPT, the better kind of output you'll get. Of course, that's how ChatGPT works. So so there are prompts where you can get ChatGPT to play an ACT therapist, can play a pure CBT therapist. Also, you give a whole clear prompt about being non-judgmental, asking questions, probing further, uh, looking for emotions, and and it does do that job decently.
Okay.
But of course, the other problem is it has no memory per se.
Correct.
So after if you lose track for 5 minutes and then join in again and continue that conversation, ChatGPT may not know what it was doing before. So
Okay.
there are issues, of course, but yes, it's a start of looking at things.
But even if, say, suppose the conversation was to be continued and the person doesn't go offline or, is in that conversation continuously, do you think that AI or like ChatGPT, or for example, can actually replace humans? I mean, what about emotional quotient, right? Because emotional quotient is
Also,
something that we look at in therapists.
correct.
And I don't think AI can have that per se, like as a quality.
So so again, that's why that question on whether you'll be comfortable speaking to a bot, right? And most people said no, which is the fact, right? Because that people would want to know that they're speaking to someone who's human and who's connected to them and feels emotions the same way uh, that they do. So, but at the same time, it is it is a tool that can be available all the time.
Hmm.
Your therapist may not be available all the time. Uh, so it can work as a support. It can work as an intermediary. Uh, and my so technology, of course, will continue to develop. We know that whenever new technology gets added, it finds its way into day-to-day life,
Correct.
and so it will definitely reach a point where and so just to uh, quote an old example, there there was a time when for example there were x number of chartered accountants all over the world. And then came Tally and all the sort of computerized things that made their life a lot easier. Did that mean the number of CAs decreased over a period of time? Or they got replaced because of these technologies? No. They just automated their own jobs and did more effective work.
Right.
So that's what is going to happen with mental health as well. And honestly, like you were pointing out, uh, for AI to effectively replace a therapist or a mental health professional is probably the last frontier in AI, right? Because
Yes.
we know how the brain and really being able to understand the brain in detail is the last frontier
Hmm.
in science itself. So a replacement of um mental health professional by AI would probably be the last frontier. But definitely it's going to be useful as help, as assistance, and technology will come. We can't stop it. Uh, it will be available to us to help us. We need to be ready to accept it. Accept it in the sense, help us do better. So so uh, often again, and what I would say is that it may not replace therapists, but the therapists who use technology more effectively will definitely replace the therapists who don't.
Absolutely. Very interesting point of view. Very common, but like I don't think it's spoken about much in terms of like therapy and all. I have two questions. One is, do you think that it'll be easier for AI to replicate a psychiatrist's job than a psychologist's? Because a lot of,
Ah, okay.
when we look at DSM criteria, right? Like in terms of counseling psychology and a psychiatrist's job per se, because we
Hmm.
look at a lot of DSM criteria to tick things off. But in counseling psychology, it becomes a little more, slightly more subjective than it is with comparing symptoms to a DSM-5, because that is, I mean, the point of having the DSM is to sort of, you know, have like a proper list that you can compare to.
But that's again so, so whether interesting whether it's more likely to replace a psychiatrist or psychologist. I don't think it matters much because again criteria are finally uh, to assist us like
Right,
like like technologies. uh, Criteria don't make or break diagnosis, honestly. uh, so like you're saying, whether it will help us more in terms of, okay, from when I look at it from a psychiatrist perspective, what it helps us with is like looking at drug interactions, for example, giving us a more exhaustive list, which is already available and makes our life a little easier in terms of looking at if a patient is on multiple drugs as well, non-psychiatric, the interactions, what happens, those are things that it can assist you with. But in terms of being able to make uh, an effective diagnosis, in terms of okay, uh, when we look at patients, there is a certain amount of pattern recognition that happens, right?
right,
Which may not be defined in terms of criteria. That kind of pattern recognition, uh, ideally, this one would the AI would like to do. But AI finally is based on what data is given to it. So if you give it poor quality data, you will get poor quality output. So in AI terms, they call it garbage in and garbage out. So so basically, they're saying that if you give it pathetic data, you will get pathetic outputs, and that's the whole key, right? The good quality data is one of the major hindrances in uh, AI developing effectively in terms of mental health.
right,
Where is that good quality data? Good quality data about patient interactions that comes with so many questions about privacy, all of that. So we're looking at how whether a computer can look at an interaction and be able to qualitatively read uh, between the lines, literally.
right.
So
Yeah.
I don't
And
think it matters. Finally, both whether psychiatrists, psychologists, counseling, clinical psychologists all work with the same cluster of patients.
absolutely.
Uh, it's just that our approaches may be slightly different, but at the end of it, all we look to do is help, right? And it can help us help better. Possibly that's what we're
True.
looking at.
Yes. I absolutely agree. My second follow-up question was about something that you mentioned before. You said that AI chatbots, they can be available anytime, unlike therapists. Um, except for except for people going through trauma or patients who are at a point of, harming themselves or somebody else.
Hmm.
This sort of point of therapy, at least up until what I have learned, is about not making the client dependent on you. That
Right.
is how that is how we also, come out of the regular weekly appointments also, that okay, we're meeting bi-weekly now
I
and once a month. How do you think
understood.
that will be different? Because
No, but
AI, like
then
you said, it's always
my
there.
my question to you is, who is to stop a client from doing it? Now,
Pardon?
simply put,
Yeah,
ChatGPT is not developed for therapy purposes,
that's true.
clearly, and that's very clear from OpenAI that this is not for therapeutic purposes, right? But does that mean that people have not used it?
I mean, they have. Obviously, they have.
Exactly. So there isn't we you can't get people to stop using certain technology, which may not be made for that purpose either. That's the point I'm trying to make. So although it's not made for therapy, but people have still tried to seek therapy from it, including you, in whatever way as an experiment. But
Yeah, fair
uh,
enough.
so that's
But
the whole point, right? You can't stop people from doing it. It is, like I said, it may be an add-on help in some way.
correct.
It may, but then again, there are a lot of issues, right? Are we? Is this? It's not its primary purpose. Where is the data? Where is the privacy? What if? What if it doesn't respond in the right manner because there are different at different points of time it may respond very differently. So to the
Correct.
same question, sometimes it gives a 5-page answer, and sometimes it gives a one-line reply. So
Yes.
there is so much inconsistency, but at the same time we can't stop it from being used, and we can't sort of um, so then if you're looking at um, so my submission is that we uh, just to sort of say what people don't want like to hear is that uh, this is technology is coming. Do we want to be part of it, or do we want to say that somebody else worked on the technology and went away?
Right.
So it
Um,
sort of it may just mean that then uh, people will someone will build something and start using it and applying it and get legal sort of approval for it, and then
right.
we won't be able to do anything about it. So should we be part of creating this, or should we say that let it happen and then we'll see?
Yeah. Right. Um,
That's
Now, apart from ChatGPT, I know it's AI, but there are also applications and websites where the AI is made for therapy. Do you
correct.
think that is more
Exactly.
better? Because like you mentioned, that the information that you're giving in is the sort of output that it will give back,
Right.
right? But
So that's something I thought we should talk about, right? There are bots
yeah,
built specifically for therapy. There's WoBot built by Stanford. There's Visa that's built in India, and quite effective in the sense, definitely in terms of overall acceptance. Um, so Visa has now tie-ups with the NHS. Uh, it has tie-ups with many ministries of health in the African continent, and they do basically it's a CBT based bot
okay,
with some cues for mindfulness and all of that put in. It is supported by a group of therapists, right? So, in case at some point it finds that things are not going in the right direction on the bot, uh, a therapist will check it, right? Like happens with your Swiggy chats. Uh,
correct,
Initially, you'll be talking to the bot, and then when uh, when the person is free, he'll log in, or when you feel that things are not going in the right direction, they'll log in, and they will also support you. The therapist will support you, and this is doing fairly well and is well established now.
right. Um, Quickly coming to a little bit of comparison between you as a psychiatrist and bots, uh, the amount of time that I observed clients with you, uh, patients with you, you sort of have a humor when it comes to dealing with patients or having really long sittings with the entire family or something. How do
Hmm.
you think? I mean, how does that, first of all, help you in your profession? And do you think that is something that bots will eventually learn to adapt to? Because especially in India, I mean, family is something that comes in most of the times with
Absolutely.
the patients or with the client.
I agree. I agree
Yeah,
completely. I think, and like you pointed out, treating a patient involves treating the entire family because there are
absolutely.
family members with issues. There is the expressed emotion involved. There's the uh, mm, anxious parents, anxious spouses, not knowing how to deal with the patient, etc. I think, yeah. So obviously, and again, although I'm saying technology is here to come. I also said that mental health is probably the last frontier for technology because technology will have to have perfected in itself enough. And so uh, all AI, and this is a very old concept but still holds today, is supposed to finally fulfill what's called the Turing's law. So what Turing's law means is that when you talk to the bot, you should not be able to differentiate between the bot and the human.
Right.
Huh. So, but then that is very hard to do.
Yeah.
It is going to need a lot of perfecting over a period of time. Will the bot interact with the family? But obviously, when you think about all these possibilities, you also start working on all of these possibilities, right? Uh,
Right.
you start looking for solutions for those. You say, okay, we want the bot to also interact with the family, explain to the family the patient's condition, what they can do to help the patient, what they can do to support the patient. So, can we sort of make this information available more easily using technology? So, if we can reach the right kind of information to those people, will it make things easier? Will it uh, will it increase the efficiency of the mental health professional?
Right.
That's the question, right? Again, the other way of looking at it is, if I spend that 1 hour with a patient in a day, uh, my number of hours are limited.
Correct.
So I can only spend that much time. Will me needing to see more patients lead to less time being spent? Of course, I
Yeah.
I choose not to do that, but with the kind of volumes that we deal with, it could affect the number of amount of time that we spend with patients, right? So, can we reduce that time? Can we make some of this information available more easily? Can we make can we allow uh, people to access this information directly via assistant, or assistant meaning assistant which may be a bot, right? Which
Correct.
is providing this information, which is making this easier for me to do. Maybe that's the way we
Right.
can look at it.
Okay, just to like
That
come
was,
back to the
I think you made me think.
that was the point of like, just getting your
Correct.
insights on
So the
this.
possibilities are endless, right? And
Correct.
the the point is also, like you're saying, unless we have these conversations, we don't know about the possibilities.
Absolutely.
And
Um,
also, people
so,
developing technology don't know about the possibilities.
correct. So yeah, that is what I want to tracing back to the poll that you had put up on Instagram. Were there any interesting views that came up to you? Like you said, most people voted no, but were there people who voted yes? And like, were there
Hmm.
any comments on like why,
Correct.
or did you
So
have
there
any
was there was
conversations?
there was that group that voted yes based on the fact that uh, we feel completely not judged.
Correct.
We know that this is a machine that definitely doesn't know how to judge.
Right.
So there is
Right.
that element to
Yes.
it also, where it says, okay, this is someone that is completely neutral, uh, but then completely neutral is also a problem, right? Because that's where we're
Yes.
looking at, if it doesn't come from empathy, from a humane touch. Where is this going? Those are the questions. So again, I think it's easier to mechanize or automate the tasks that don't involve us being there for the patient.
Correct.
But patients want us to be there, right?
Yeah.
Also, I think it's interesting how before COVID, I used to do online consult, and people were some people were keen, but some people were totally not keen. But after COVID, there's more acceptance.